Welcome to the Scenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Welcome to the Deep Dive, where we sift through the latest research and your questions to unearth the most compelling insights. Today, we're plunging into a topic that, well, in some form, touches almost everyone: phobias. It's so much more than just a passing fear, It's a world where the mind's alarm system kind of misfires, creating these intensely real and often debilitating experiences.
Exactly. While we all experience fear as a natural sort of adaptive response, phobias represent a distinct and far more profound mental health concern. They affect a significant portion of the population at some point in their lives. Our mission in this exploration is really to dissect the incredible diversity of these irrational fears, from the commonly understood ones to the, well, truly obscure, and crucially, to understand their intricate causes and the effective strategies available for managing them.
So, prepare to explore the astonishing landscape of human fear and discover why delving into these deep-seated psychological responses offers not just fascinating facts, but also maybe a pathway to greater empathy and understanding for ourselves and others. Let's get started. Okay, so we often casually say things like, oh, I'm terrified of heights, or spiders just give me the creeps. But what truly distinguishes that common aversion, that everyday anxiety, from a genuine clinical phobia, as defined by mental health professionals?
That's a fundamental distinction, and it's a critical one for our understanding today. Fear is normal. It's an evolutionary-rooted reaction to a real and present danger. It's basically what kept our ancestors alive.
Right, the saber-toothed tiger response.
Precisely. A phobia, however, is characterized by an irrational, excessive, and persistent fear of something that objectively poses little or no actual threat. Our sources highlight that it's classified as a type of anxiety disorder, and the emotional and physical reactions are so intense, so disproportionate, that they can severely disrupt a person's daily life, their decision-making, their overall well-being.
It's like an alarm bell ringing incessantly, even when there's absolutely no fire. So it's not just about the intensity, but really about the impact on daily function.
Exactly. That's key.
And what's fascinating here is how varied human fears can be.
Yeah.
You mentioned it's influenced by this complex interplay of biology, environment, culture, personal history. The sources we looked at showcase phobias that are common, some that are context-specific, and others that are just, downright unusual. How do psychologists bring some order to this incredibly diverse landscape? Is there a system?
Yes, they do this by categorizing them, which helps a lot in both diagnosis and understanding the underlying mechanisms. While the initial classification broadly separates phobias, the distinct underlying psychological and neurobiological pathways make each category unique in how it presents and how you treat it. Generally, we look at three main types. First, specific phobias. These are the most prevalent and involve an intense irrational fear of a particular object or situation. Think animal phobias, like the well-known arachnophobia, fear of spiders, or ophidiophobia, the fear of snakes.
Pretty common ones.
Right. Then there are natural environment phobias, such as acrophobia, the fear of heights, or maybe astrophobia, the fear of thunder and lightning. We also have situational phobias, which include fears of flying aerophobia or enclosed spaces, which is claustrophobia.
Okay.
And a distinct subset, often with a really unique physiological response, is blood injection injury phobia, or BII. Here, the site of blood, needles, medical procedures. It can trigger not just fear, but sometimes this vasovagal response that leads to fainting.
Wow, fainting. That's intense.
It is. And then the second type is social phobia, now more commonly called social anxiety disorder. This isn't just shyness. It's a profound fear of social situations or being scrutinized, judged by others. It can manifest in public speaking, sure, but also eating in public or even just interacting with new people.
So really limiting.
Very much so. And the third main type is agoraphobia. This is often misunderstood. It's a fear of situations or places where escape might be difficult or maybe embarrassing, or where help might not be available if panic symptoms strike.
Like crowds. Or being far from home.
Exactly. Crowded spaces, open spaces, public transportation, even just leaving one's home sometimes. It's often highly debilitating because it restricts a person's life so significantly.
It's clear that these classifications are more than just labels. They're really vital tools. And as we consider the specific phobias, our sources truly open our eyes to the intricate workings of the human psyche and the sheer variety of ways these fears manifest. Let's delve into that astonishing AZ list you mentioned. I mean, many of us have heard of, or maybe even mildly experienced, something like arachnophobia, the fear of spiders, or aquaphobia, the fear of heights. These are common, right? Often have evolutionary theories attached to them.
That's right. Potential ancient dangers.
But then you encounter fears that profoundly impact daily life, like claustrophobia, that terror of enclosed spaces, or glossophobia, the paralyzing fear of public speaking, that one can genuinely derail careers and isolate people.
Absolutely. And what's truly insightful here is the spectrum. Beyond the immediately recognizable, we find very real and often debilitating phobias like dentophobia, an intense fear of dentists or dental procedures that can lead to severe health neglect because people just won't go.
Oh, definitely. I can see that.
Or emetophobia, the profound fear of vomiting. This can result in extreme dietary restrictions, social avoidance. It creates significant distress and isolation. These are not minor discomforts. They profoundly shape a person's reality.
And then, as you touched on, there are the ones that really make you pause and wonder about the mind's incredible capacity for association. Our list includes arachibutyrophobia. That's the fear of peanut butter sticking to the roof of your mouth. Really?
Yes, really.
Or claustrophobia, the fear of clowns. What can these seemingly bizarre phobias tell us? Like, about how the brain learns associations?
Well, these seemingly unusual phobias are fascinating precisely because they offer a window into how the brain makes connections, sometimes faulty connections. Arachibutyrophobia, for example, might seem amusing on the surface, but it could potentially stem from a past choking scare or maybe an underlying sensory processing sensitivity, where a specific tactile sensation triggers an intense anxiety response.
Ah, okay. So there's a logic, even if
Yeah.
it seems strange.
There's often some kind of originating logic, yes. Similarly, coulrophobia, the fear of clowns, often isn't about the literal person in the costume. It might be more about the uncanny valley effect, that unsettling combination of human-like features with exaggerated, unnatural expressions, perhaps amplified by a scary childhood experience, or how clowns are sometimes portrayed in media.
True, horror movies haven't helped clowns much.
Not at all. It highlights how intensely personal and often seemingly inexplicable the origins of phobias can be.
It really underscores that almost anything can become a trigger, given the right or maybe wrong set of circumstances. We also see things like gamophobia, the fear of commitment or marriage, which seems to speak to deeper anxieties about vulnerability and change. Or somnophobia, the fear of sleep, which is just profoundly paradoxical, isn't it? Sleep is a biological necessity.
It is, and that makes it particularly distressing.
And quinonophobia, the fear of being in a room with other people. That sounds like social anxiety pushed to an absolute extreme.
It can be related, yes, or have distinct roots.
These examples truly showcase the vast and often perplexing spectrum of human experience and the diverse triggers that can manifest as genuine, debilitating phobias.
Absolutely. They demonstrate the brain's incredible capacity for both protection and sometimes misdirection.
Given this huge range of triggers, let's explore the physical and emotional toll. When someone with, say, ophidiophobia, the fear of snakes, encounters one, or maybe even just imagines it vividly, what actually happens inside their body? What's that physiological and psychological response like?
Okay, so the body's alarm system essentially goes into immediate overdrive. It triggers a cascade of both physical and emotional symptoms that can be incredibly intense and prolonged too, often lasting for many minutes. And these reactions are profoundly disproportionate to the actual threat posed by, say, a picture of a snake or a snake behind glass.
Right.
Physically, common symptoms include a rapid heartbeat or palpitations, a sense of breathlessness or hyperventilation, often with chest tightness. It feels like they can't get enough air.
Scary.
Very. Sweating, chills, trembling, shaking are also very common. People might experience nausea, dizziness, a dry mouth, or even a choking sensation. This all stems from the body's fight-or-flight response redirecting resources.
Okay.
Emotionally, there's often an overwhelming sense of impending doom, this feeling that something terrible is about to happen. This can escalate into a full-blown panic attack. And critically, these experiences almost invariably lead to significant avoidance behaviors. The individual will go to great lengths, even if it means severely limiting their life, to prevent encountering the feared object or situation again.
It sounds incredibly debilitating, just exhausting to live with.
It really is.
But what's the scientific consensus on why? Why can these triggers, whether it's a snake or sticky peanut butter, send the body into such a profound state of panic, even when the rational mind knows there's no real danger? What ignites this disproportionate alarm system in some individuals and not others?
That's the million-dollar question, isn't it? And the answer is complex. It's rarely attributable to just one single factor. Phobias typically stem from a multifaceted interaction of genetic, psychological, and environmental factors. It's often described as a sort of perfect storm of influences.
Okay, a mix.
It's a mix, yes. One major contributor is traumatic experiences. A direct negative encounter, like, say, a particularly vicious dog bite, can hardwire a fear response, leading to xenophobia, the fear of dogs. Similarly, a really turbulent flight might trigger aerophobia.
That makes intuitive sense.
Right. Our sources suggest that the amygdala, the brain's fear center, can become hyper-responsive after such an event. It creates this false alarm system that continues to fire even when no real danger is present. The brain essentially learns very powerfully to associate that object or situation with extreme danger.
Learned danger. Okay.
Then there's learned behavior, often through observation. Children, for example, can develop phobias after watching intense, fearful behavior in parents or other significant figures. If a parent consistently reacts with extreme distress to a spider, a child might internalize that response, believing spiders are inherently dangerous, and develop arachnophobia through what we call vicarious learning.
So they pick it up from others.
They can, yes. Genetics and brain chemistry also play a significant role. Research indicates some individuals are genetically predisposed to anxiety disorders generally. This makes them inherently more susceptible to developing phobias when exposed to triggers. It could involve imbalances in neurotransmitters or maybe an inherited tendency towards a more reactive nervous system.
So some people are just more wired for anxiety.
It seems that way, yes. More susceptible. And finally, cultural and societal influences can profoundly shape the emergence of certain phobias, or at least fear responses. While not always rising to the level of clinical phobias, terms like xenophobia, the fear of strangers or foreigners, or even some hynophobia, the fear of Halloween, can be influenced by prevailing societal norms, collective beliefs, or media portrayals that amplify certain anxieties or superstitions.
Interesting. So it's this blend of nature and nurture, personal history, and inherited tendencies, maybe even culture, which leads to, I think, the most important question. If these phobias can be so profoundly disruptive, are they treatable? Is there genuine hope for people living with these intense, sometimes life-limiting fears?
Absolutely. And this is such a crucial message to convey. Phobias are highly treatable conditions. That's really important. With appropriate therapeutic intervention and support, individuals can not only learn to manage their fears effectively, but often significantly reduce or even entirely overcome them. This leads to a dramatically improved quality of life. The effectiveness of treatment is honestly one of the most encouraging aspects of this field.
That's great to hear. So what do these treatments look like?
Well, one of the most common and evidence-based treatments is cognitive behavioral therapy, or CBT. CBT helps individuals identify and challenge the irrational thought patterns and maladaptive behaviors that fuel their phobia.
Okay, so changing the thinking.
Exactly. For example, someone with a spider phobia might believe, this tiny spider will definitely jump on me and bite me and I'll die. CBT helps them systematically challenge this cognitive distortion with evidence-based reasoning. They learn to restructure those thoughts into more realistic ones, like, okay, the spider is small, it's more scared of me, and I am safe.
Right, challenging the automatic scary thoughts.
Precisely. Then there's exposure therapy. This is often a core component of CBT and widely regarded as the most effective treatment for specific phobias. This technique involves gradual, controlled exposure to the feared object or situation, but in a safe environment.
Facing the fear, basically. But
Right.
slowly?
Slowly and safely, yes. The process helps to desensitize the patient over time. Instead of avoidance, they learn that the perceived threat doesn't actually lead to the anticipated catastrophe. This helps to extinguish the fear response through habituation.
So like looking at a picture of a spider first.
Exactly. Maybe starting with looking at a picture, then a video, then perhaps seeing a spider in a sealed container across the room, slowly building tolerance and reducing the fear response at each step.
Okay.
And our sources even point to cutting-edge applications like virtual reality exposure therapy, VR.
Oh, interesting.
Yeah, it offers a highly controlled and customizable environment for confronting fears like flying or heights. It's a significant innovation, really helpful for certain phobias.
I can see how that would work. What about medication?
For more severe cases, medication can be a valuable adjunct, prescribed by a medical professional, of course. This might include anti-anxiety medications for acute panic symptoms, or beta blockers to control those physical manifestations like a racing heart or trembling. Sometimes antidepressants are used for long-term management, especially if there's underlying anxiety or co-occurring depressive symptoms.
So medication is more for managing symptoms.
Often, yes, particularly for specific phobias. It doesn't usually cure the phobia itself, but it can make therapy more manageable or help control intense physical reactions.
Got it. Are there other things people can do?
Definitely. Beyond formal therapy, relaxation techniques like mindfulness, deep breathing exercises, progressive muscle relaxation, these provide individuals with practical tools for self-regulation. They help reduce anxiety symptoms and manage daily stress when confronted with triggers or even just anticipating them.
Tools for the moment.
Exactly. And finally, never underestimate the value of support groups and counseling. Connecting with others who share similar fears provides a safe, non-judgmental space. It's good for emotional support, sharing experiences, exchanging practical coping tips. This can significantly reduce feelings of isolation and stigma.
That makes sense. Feeling less alone is huge.
It really is. And it's also worth noting that while maybe a very mild fear might fade on its own, most clinical phobias tend to persist and often worsen without intervention.
So treatment is usually necessary.
For significant phobias that cause distress or avoidance, yes, treatment is generally recommended and highly effective. And yes, it's very common and entirely treatable to have multiple phobias. The treatment plan just needs to be tailored and integrated.
Wow, what an incredibly comprehensive journey into the world of phobias. We've gone from defining these clinically recognized anxiety disorders, distinct from everyday fears, to exploring their astonishing diversity, understanding their debilitating impact, and most importantly, highlighting the very real and effective treatments available.
Absolutely. And knowledge is most valuable when it's understood and applied, right? Recognizing the subtle nuances of symptoms, understanding that complex interplay of causes, and knowing that effective evidence-based treatments like CBT and exposure therapy exist, it empowers not just those who suffer from phobias, but also their loved ones, their support networks. It really underscores the importance of empathy, helps reduce stigma, and highlights the necessity of seeking professional help when these fears start to diminish someone's quality of life.
So as you reflect on this exploration, maybe consider this. We all have our own triggers, right? Those small things that make us a little uneasy or even jump. What seemingly irrational reaction might you have that, if amplified, could offer just a tiny glimpse into the mechanics of how a phobia works? And how might understanding this entire spectrum of fears, from the common to the truly unique, help you approach your own anxieties, or maybe those of others, with a deeper sense of empathy and insight? Something to think about. Thank you for joining us on the Deep Dive.
Thanks for tuning in to the Scenario Podcast. Don't forget to visit scenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.